Hello. Here's my audience for today. Audience. All right. And James is back here too, working the cameras. I want you to picture a person with arthritis. In your head, you're probably thinking about a frail old person, uh, maybe somebody walking with a cane or a walker. But what if I tell you not everybody who has arthritis is a frail old person? What if I tell you that a seemingly healthy young person standing in front of you today has arthritis and has since the age of 11? According to the American College of Rheumatology, about one child in 1,000 develops some type of arthritis during their lifetime. And additionally, around 300,000 children in the United States have been diagnosed with juvenile idiopathic arthritis. Let's look at the different types of JIA, the nature of the illness, and the treatment for the disease. I hope to inform you about how the disease works and also that arthritis affects everybody. So let's find out what JIA is and how it works. Juvenile idiopathic arthritis, or JIA, formerly known as juvenile rheumatoid arthritis, or JRA, is a type of arthritis that, according to the National Institutes of Health, happens in children aged 16 or younger. It causes swelling, pain, stiffness, and loss of motion. JIA is an autoimmune disorder. What this means is that it's caused by the body's own immune system, which is normally responsible for keeping the body healthy and fighting infection. The body's immune system starts attacking the body itself. It causes an inflammatory response in the body, usually focused in the joints of the body. And what happens is that the white blood cells and other molecules of the immune system start to cause an inflammatory response in the joint, causing a breakdown of the synovial membrane in the joint. So here we see a normal joint. The synovial membrane surrounds the joint here. This is a picture of a knee. So the synovial membrane surrounds a joint, acts kind of as a shock absorber, helping to cushion the joint and prevent any damage to the joint from normal everyday uses. In a person with JIA, the synovial membrane becomes inflamed and eventually breaks down and hardens and also causes a loss of cartilage here. So what will eventually happen is that the joint will start to degrade and the bone will deteriorate. From rubbing together eventually, causing the destruction of the joint. Symptoms of JIA include limping, stiffness, reluctance to use an arm or a leg, lower activity levels, fever, and loss of fine motor skills. The cause of JIA is unknown, but some research does suggest that there is a genetic predisposition to the disorder and that it is triggered by a disease or another unknown trigger during childhood. JIA does not just affect each person the same. Let's take a look at the different types of juvenile idiopathic arthritis. According to the Arthritis Foundation, there are 6 different types or subsets of juvenile idiopathic arthritis. They include oligoarthritis, which affects 4 or fewer joints, polyarthritis, which affects 5 or more joints. Systemic arthritis occurs in about 10% of JIA cases and causes inflammation of not just the joints but the organs of the body as well, including the lung and the heart. Enthesis-related arthritis, which includes inflammation of the entheses, which is the parts of the bone where the tendons connect. Psoriatic arthritis, where there's not just swelling and inflammation in the joints, but also psoriasis, which is a red scaly rash. And then the 6th subset is other, which is unknown cause. It's JIA, or JIA that includes a combination of symptoms from the other subsets. So now that we know what JIA is, let's look to find out how it is treated. There is no cure for juvenile idiopathic arthritis, but it can be controlled by medications. The first line of treatment for JIA is non-steroidal anti-inflammatory drugs, or NSAIDs. That includes ibuprofen and Aleve, which can be found over the counter. These drugs reduce inflammation in the body and help to relieve pain. The second line of defense is disease-modifying drugs. These drugs include Plaquenil, which was originally an anti-malarial drug, as well as methotrexate, which is actually a chemotherapy drug. These drugs can be effective and help reduce symptoms, but they can also have severe side effects. Plaque can cause retinopathy, which is damage to the retina or the image processing part of the eye. And the methotrexate can cause symptoms like chemotherapy, such as nausea, vomiting, loss of weight, and immunosuppression. The newest class in treatment is called biologic. These drugs include tumor necrosis factor agents or TNF inhibitors. Some of these drugs include Enbrel, Remicade, Humira. These drugs can be very successful and reduce symptoms and flares and help children lead near normal lives. But they can also have some very severe side effects as well, including immunosuppression, where the body's immune system is suppressed so much that the child succumbs to other disorders or diseases. Also, these drugs do increase the risk of cancer, such as lymphoma, after long-term use. Also, these drugs are given by injection and intravenous administration, which can be difficult for a child to undergo. So let's summarize what we've learned today. JIA is an autoimmune disorder where the body's own immune system attacks the body and the joints. The cause is unknown. There are multiple types of JIA, and treatment can be effective and help kids lead normal lives and with fewer symptoms. So now, when you think about a person with arthritis, I want you to remember that it's not just old people who get arthritis. There are hundreds of thousands of kids who suffer from it every day. Arthritis has many faces, and one of them is mine.